Okay, recording start. So this kind of explanation you can give to the patient, and that is very much important. Homeopathic medicines are going to stabilize your immunity. Homeopathic medicines are going to reduce the intensity of your increased immunity. And that is why homeopathy can help you for a longer period. पेशेंट का नेक्स्ट क्वेश्चन होगा कि सर ये कंप्लीटली क्योर हो सकता है पेशेंट को बोलो वी कैन गिव यू रिलीफ विद द पेन एज इट इज ऑटोइम्यून डिजीज लैब के जो स्टेजेस होते हैं वो स्टेजेस के साथ दैट कैन बी इंक्रीज और दैट कैन बी ट्रिगर्ड आउट तो जब भी पेशेंट इज इन पीडियाट्रिक फेज जुवेनाइल आरए फैक्टर आरए पॉजिटिव आ रहा है इफ दे आर चेंजिंग टू द अनदर स्टेज तो वो पीडियाट्रिक में से एडल्टहुड में जा रहा है या टीन एज में आ रहा है और उसके बाद एडल्टहुड में जा रहा है या फिर वो पेशेंट मेनोपॉज में एंटर हो रहा है इन दोस टाइम पेशेंट गेट ट्रिगर विद द पेन so those are the triggering factor of life in autoimmune diseases so in those cases in those time you can be triggered with the symptom otherwise generally patient get completely asymptomatic with medication, right? So guys, RA, rheumatoid arthritis, it is autoimmune disease. It is a chronic inflammatory multisystem disease involving articular and extra-articular tissues, right? कौन से risk factors है for RA? So idiopathic. Many patients having idiopathic cause, there is no cause. Many patients having genetical cause or the inherited family history, that is called as positive family history. Another triggering factors, smoking is there. Even any acute bacterial or fungal infection, even that can trigger the RA. Family history है लेकिन ऐसा कुछ bacterial infection body में आ गया, that just trigger the RA. Herpes simplex is one of the triggering factor of RA. When you are going to treat the RA और जिसमें कोई cause नहीं मिल रहा है तो ask the patient कि आपको herpes वगैरह कुछ हुआ था, fever blister हुआ था, anything such thing that can trigger the RA. And vitamin D deficiency is one of the cause according to theory. Vitamin D is the basically deficiency, लेकिन it might be trigger. तो आरए को कैसे डायग्नोज करना है इन योर क्लिनिक एनीवन हाउ डू यू डायग्नोज आरए इन योर प्रैक्टिस कैसे डायग्नोज करोगे साइन एंड सिम्टम्स क्या होंगे क्लिनिकली एनीवन as I always say the sessions will be of two sides. This is not a lecture, this is a session. So two side hoga so there will be more fun and be a good participant. गलत हो सकता है सही हो सकता है there is different thing. Yes, Bhargav, morning stiffness is the key of rheumatic arthritis and better by motion. So our well-known remedy, our favorite remedy of homeopaths for RA, the common modality of RA is first motion aggravation or morning stiffness. So we can think of our favorite remedy. Yes, Neelam. Yes, Bhargav. Yes, Dhanusha. That is Rastos. Yes, Selva. That is Rastox. So that is the common symptom of RA. So when you are treating RA with Rastox, RA with RT, Rastox, then you can stabilize the symptom very easily. Because those are the common symptoms. And we are prescribing on uncommon symptoms. When you are prescribing on uncommon symptom, that can be cured or that can be subside completely. If you are treating with the common symptom, that is okay, not to worry at all. That gives relief a lot to the patient. But in each and every case of RA, there is no need to prescribe RT. Try to find out any specific modality of RA in the particular patient. Try to find out the time modality, try to find out the thermal modality, whatever kind of thing you get, which is uncommon for the particular patient. Try to find out, and that single symptom can lead to you to the complete relief to the patient. I would like to give one example of my RA patient. She came to me since 3 years. 3 साल से उसकी दवाई चालू थी. As I am a common homeopath, तो मैंने आपके जैसे ही रस्टोक्स दे रहा था उसको. वो बोल रही थी सर मॉर्निंग में उठूं तो मुझे दर्द होता है, मॉर्निंग में स्टिफनेस होती है, मॉर्निंग में रेडनेस होती है. मोस्ट कॉमन सिम्टम्स ऑफ RA. I prescribed Rustox, I prescribed Pulsatilla, I prescribed many other remedy. लेकिन जब it is not getting cure, it is not getting relief, then I asked her some more question. I get to know from her कि सर मैं मुझे मॉर्निंग स्टिफनेस रहती है, मैं चलती हूँ तो अच्छा लगता है, लेकिन मुझे दिन के टाइम में भी जब भी पेन होता है तो मैं कांस्टेंट चलती रहती हूँ. Are you getting my point? Constant motion gives relief, guys. See, Rostowski, this is the modality कि first motion aggravation, continuous motion amelioration, morning stiffness, everything was there. लेकिन कांस्टेंट चलती रहती है. जब शी गेट पेन, उसको स्मॉल जॉइंट पेन के अंदर भी दर्द होता है तो शी जस्ट मूव अराउंड द रूम. उसको जब नी के अंदर पेन होता है तो शी जस्ट मूव अराउंड द रूम. व्हाट विल बी योर प्रिस्क्रिप्शन? क्या प्रिस्क्राइब करोगे? We have to find out the specific uncommon symptom of the case, whatever it may be the cause. OA है, RA है, gout है, whatever it may be. When you get the modality, you can simply prescribe the medicine. Anyone? Continuous motion gives relief. This voila. Constant motion. Anyone? Dhanushya, spider remedy? No. Colophylum? No. Ruta? No. Medoranum? No. Radium brom nikal. Open radium brom from the boring. Guys, open radium brom. It is one of my favorite remedy. And we are frequently using this remedy. When patient is telling you, constant motion से अच्छा लगता है. Anyone can read radium brom? Radium brom is generally used for acne. Homeopaths are using that remedy for red acne or rosacea. But it is one of the good remedy. AG or
कागल छाते अपने मम्मी.
yes.
पेन में कागल.
Sir,
Anyone can read?
yes, sir, in radium medicine,
नहीं पड़ा.
better by continuous motion.
See in modality. I'm not able to hear you. कुछ बोलो तो ऑन करके. Mute. Okay. Now is it okay? Yes. Open radium brom and modalities, better open air and continuous motion. Hot bath, lying down, pressure, worse getting up. Continuous motion gives relief. That is radium brom. Continuous चलता रहता है, continuous motion करता रहता है. If patient having pain over here, continuous motion करता रहता है, which gives relief. If you are not getting result with Pulsatilla, first motion aggravation, If you are not getting result with the stocks, first motion or continuous motion, not amelioration, not giving relief to the patient, in those cases, you can think of this remedy. That is radium brom. Are you with me? Can you do extremities from radium brom, Rizwana?
Severe pain in all the limbs, joints, especially in knees and ankle. Sharp pain in shoulder, arms, hands and fingers. Legs, arms and neck feel hard and brittle, as though they would break on moving. Arms feel heavy, cracking in shoulder, pain in toes, calves, hip joint, popliteal space. Muscles of legs and hips sore. Arthritis, aching pain, worse at night. Dermatitis of the fingers, atrophic changes in the fingernails.
Yes. And which gives relief with continuous motion. You can think of radium here 200 single dose. You can think of radium brom 200 TDS. You can think of radium brom 200 OD as per intensity of the symptom. Yes, Dr. Shreya, welcome. Welcome to the community. गोवा में एटमॉस्फेयर कैसा है? She is basically from Goa. तो जब भी गोवा की बात होती है तो एक वाइब्स आ जाते हैं गोवा. Okay, so like Rustox, like Pulsatilla, both having continuous motion amelioration, both having first motion aggravation, guys. So how will you differentiate Pulsatilla and Rustox in your clinic? Anyone? Anyone having differentiating point between Pulsatilla and Rustox? Anyone would like to share their experience between the difference between the Pulsatilla and Rustox? Both having first motion aggravation, both having constant motion gives relief. Anyone? Okay. According to Priyank, thirst. So what will be the differentiate between thirst, Pulsatilla and Rustox? Rustox is thirsty. Pulsatilla pain changes, okay. Rustox aggravate by damp, okay. Getting weight, okay. Anyone? Any specific thing you are differentiating patient from? Pain shifting rapidly, okay, that is one of the thing. Wandering rheumatism is there in Pulsatilla. सर मुझे यहाँ पे दर्द हो रहा है, यहाँ हो रहा है, यहाँ हो रहा है, चेंज होता है. That is typical Pulsatilla.
Pain with chillness.
Pain with chillness, okay. Tongue of Rustox, yes. Nilam, tongue of Rustox क्या है? Pulsatilla changeable, okay. Triangular tip of tongue, yes. That is Rustox. From the continuous motion gives relief. One thing that you can ask the patient जब भी आपको बोलता है कि सर मैं चलता हूं तो मुझे अच्छा लगता है, तो ask them कि आप घर में चलते हो तो अच्छा लगता है या घर के बाहर चलते हो तो अच्छा लगता है. This is the differentiating point between Rustox and Pulsatilla. When Pulsatilla is telling you कि मुझे चलने से अच्छा लगता है, तो open air gives relief to the Pulsatilla. So Pulsatilla is walking outside the house, and which gives relief to Pulsatilla. Guys, I'm not talking about theoretical thing. This is the practical approach. You can differentiate the thing like this. You have to add one question in your routine practice. From that, you can differentiate the remedy. You know, RA के अंदर 10 medicine है, that works. You have to differentiate those medicine. That is very much important. And when you are asking to the Rustox patient, he will tell you कि सर मैं घर में चलता हूँ तो मुझे अच्छा लगता है. Walking in house, that gives relief to the Rustox. And walking outside the house or in open air, which gives relief, that is the Pulsatilla. All the symptoms are okay that you already tell कि thirstless है, thirsty है, that is okay. Pulsatilla is thirstless, Rustox is thirsty. tongue of Rhus is triangular tongue. That is perfect. Again, from the continuous motion, you can differentiate from this symptom. Are you with me, guys? These are the basic differentiating point of basic medicines. Rhus का mindset कैसा होता है? Anyone knows from Shankaran? Shankaran sir. Theme of Rhus, anyone? According to Dr. Shankaran sir, this is the theme of Rhus, guys. I would like to share one case of Rhus. One lady patient came to me. COVID के पहले का एक case है. Such cases you are not going to forget in your whole life, and those cases will refer you lots of patients when you get such result. Lady I think she was not able to walk even. She got pain on her right hip में pain था, and that pain occurred suddenly after get some jerk in routine day-to-day practice. वो कुछ डब्बा वगैरह उचकने के गई थी, and she suddenly get the pain. While asking the question, मैंने पूछा कि कैसा husband का nature कैसा? These are the common question we are asking to the patient. कि husband का nature कैसा है? She simply cried. So first thought from the cry we got pulsatilla. And she answered, sir, इतना strict nature है. He wants everything perfect. He wants everything in its own place. मुझे उनसे इतना डर लगता है कि वो शाम को घर पे आते हैं तो उसके आधे घंटे पहले मैं इतनी anxious हो जाती हूँ. And I just get fever sometime. I got pain sometime in my body due to fear of my husband. If fear or threatening is from the family member, if it is from inside the home, this is the theme of Rhus talks. If husband is alcoholic, if he comes daily with after drinking alcohol, he beats his wife, and his wife gets pain, rheumatic pain or whatever it can be, a pain, and came to you with pain, always think of this remedy, guys. Always. Fear from husband, fear from wife, that is common. हर एक husband को होता है. That is universal issue. लेकिन fear from husband हो तो that is rare nowadays. If you get such thing, so always think of Rhus. Always. Whatever it may be the symptom, joint pain है या नहीं है, कोई भी complaint हो, and when you get such situation, some situational material medical, situational thing in patient, think of Rhus. I gave her Rhus 10 single dose, and the next day she came to me specially for showing the result. She came to me, sir, आपके एक डोज के बाद I just get relief completely, and दूसरे दिन मैं चलने लगी. She came with her 3 kids. तो छोटी छोटी बच्चियां थी उस टाइम. Now those all are my patient. After 4 or 5 years, they are now in adulthood. So that kind of prescription you can give. Match mental symptom with the physical symptom. That works. That works like anything. That is why I say always, don't divide homeopathy. Learn from every way of practice. आपको पता नहीं है कि कौन सा पेशेंट क्या लेके आएगा. That helps to prescribe a medicine. I try to learn from different schools. हर एक स्कूल में से कुछ ना कुछ सीखने को मिलेगा. Don't follow only one kind of school in homeopathy. Are you with me? This is the mental picture. Read it from Saul. That will reveal your typical picture of the stocks. RA के symptoms क्या होते हैं? Basically joint pain. Especially RA के अंदर, that is the differentiating point between osteoarthritis and rheumatic arthritis. Patient having especially pain on small joint, along with morning stiffness, along with swelling. Swelling might be there, swelling not be there, whatever it may be. Lekin early morning stiffness, early morning pain, along with swelling and redness, think of RA. Not each and every patient of RA having nodosities. We have good remedy for such thing. If RAs remain for long time, that creates disability, that creates deformities, and for those deformities, you can think of our good remedy. That is, anyone? Deformities from RA. Any remedy you know, guys? See, I already told you, if we have such case, in those cases, we are not able to cure such patient. So deformity already ban gayi hai. We are not going to cure it. We are not going to straight the fingers. But we can give relief in the pain to the patient. That is called as pain management. Any remedy, guys? Yes, Pujita? Any or a mat? Okay. Yes, Himanshi? Ammonium phos? Open ammonium phos? Nikalo. I was not expecting such remedy from anyone. Himanshi, now today you are online. So that is why I can expect it from you. Ayushi, yes, iod okay. Sticta okay. Calcarea carb. Open ammonium phos from boric, guys. This is the remedy for nodosity from gout. Lekin we can think of this remedy for any kind of nodosity or deformity, ammonium phos. That is the specific medicine when you get the deformities in the joint. The first line in boric ammonium phos, that is chronic gouty patient, uric acid diathesis is indicated in bronchitis and nodosities of joint of fingers and back of hand. So you can think of this remedy for deformities from arthritis or even gout. Whatever it may be the cause, when you get the deformity, always think of this remedy. I'm not telling you ammonium phos can cure the deformity, but that gives relief to the patient. I have seen such patient, unki जो finger होती that just get deformity like this, itni bhi kam ho sakti hai. Don't tell patient कि we can cure your deformity and you will get relief in your deformities. Any other remedy, any other specific remedy like ammonium phos, any one of you know? Guys? Yes, Himanshi? That is Sabina. Yes, that is Lathiras from Arpit Gupta. You can think of it. Yes, Sabina. Open Sabina, guys. Sabina is generally is a female remedy. It is used generally for the female complaints. And Sabina is one of the good remedy for deformities. Open Sabina. Is it mentioned? मैं हवा में बात कर रहा हूँ. मैं जितना भी बोलता हूँ बुक में होना चाहिए. Not every time I am always right. Yes. Bruised pain in anterior portion of the thigh. Oh, we were discussed such thing yesterday. Guys, anterior portion of thigh. What kind of pain that can be? Anyone? Let's discuss it in sciatica. Let's talk about sabina. Shooting in heels and metatarsal bone, carpal, metacarpal, tarsals, metatarsals. That is the metatarsal at feet, metatarsal joint. Articular pain in joint, gout, warts in heated room, red standing swelling in gouty nodosities. In bracket, ammonium phos. So we have these two remedy that works excellently in nodosities or in deformities. Are you with me? This is the thing we are talking, the intense RA. Right? Morning stiffness hoti hai, that remains for hours. Prodromal symptoms we can think of fatigue, weakness, malaise are common. Disability में deformities create हो सकती है. That can be differ from person to person. Non-articular symptom में we can think of palpable lymph nodes in affected joints. RA is common cause of amyloidosis affecting the kidney and anemia. So amyloidosis can be there. Science के अंदर क्या क्या होता है? Swelling होता है, tenderness. When you check the patient, when you examine the patient gets tenderness. So always give your touch to the patient, guys. I always say, and I got advice from my father, never forget to touch the patient. Your touch can heal the patient. Always examine the patient. RA का patient है, whatever it may be that is, abdominal pain का patient है, at least examine. आपको abdomen check करना नहीं आता है, at least try to examine. आप 10 patient check करोगे, and then you feel what is the McBurney's point. 10 पेशेंट आप चेक करोगे फिर पता चलेगा, मुझे देखने को आता ही नहीं है इसलिए मैं चेक करता ही नहीं हूं. Don't make such thing. Don't say such thing. Make a habit to examine the patient. Are you with me? So tenderness is there in RA, and deformities at the last stage of the RA, and limitation of movement and muscle wasting around the affected joint. That is one of the sign of RA. Restricted movement हो जाती है. Movements get restricted due to the pain, and if deformities occur, that is completely destruction in the movement. Are you with me? This is typical RA. How can you differentiate RA from OA? Yes, this is the clinical thing you have to apply in your practice. आपको RA सिखा लिया, आपको OA सिखा लिया, आपको यूरिक एसिड सिखा लिया, लेकिन पेशेंट इज क्वाइट डिफरेंट. पेशेंट आके बोलेगा कि मुझे जॉइंट पेन हो रहा है. Now you have to differentiate the condition in your practice. So RA और OA में कैसे differentiate करोगे?
Large joint, big joint.
Yes, OA generally occurs on big joint. Patient आपको knee pain की complain करेगा rather than complaining small joint pain. I'm talking about common things, guys. RA में भी बड़े joint affect हो सकते हैं, लेकिन I'm talking about common things. OA affects large joint, yes Danusha, and asymmetrical हो सकता है, that is also in RA. And anything differentiating point RA from OA?
Cracking sound when examining the patient.
Yes, when you are examining the patient, patient gets cracking sound. What is that? That is OA or RA?
OA.
That is OA. crackling sound when you examine the patient. Patient gets that typical sound of crackling, might be OA. Yes, Bhumi? Pain in shifting in RA, okay, yes, that might be. And a slight less movement cause pain, inability to walk, okay. That is in intense pain. वो intense OA में भी हो सकता है और RA में भी हो सकता है. So these are the differentiating point. Clinically, you can differentiate OA from RA, from the joint affection, from the crackling sound. जब डिफॉर्मिटीज क्रिएट होती है इन आरए तो थिकनिंग ऑफ साइनोवियल फ्लूइड होता है और साइनोवियल फ्लूइड के साथ साथ डिजनरेटिव चेंजेस ऑफ कार्टिलेज. Degenerative changes are there in cartilages which indicate, wait a minute guys, I got a call. We were in deformity. Thickening of synovial membrane, synovial fluid is affecting, and which causes degenerative changes in cartilages. In the cases of deformity that affects on cartilage. Now, what is happening in OA? OA में क्या होता है guys? Synovial fluid dry out हो जाता है, okay. And where it affects, OA कहाँ पे affect होता है? Bones में bones में नहीं, joints में होता है. Joints में कहाँ पे? Anyone? OA में कहाँ affect होता है? Anyone? That is cartilages. Cartilage के affect होता है. Yes, नीलम osteophytes create होते हैं. That is in OA. OA के अंदर osteophytes create होते हैं. And OA के अंदर affection is on cartilage. Both having cartilage. I am coming to the point. When there is affection on cartilages, we have one good remedy which is not used frequently in homeopathy, but this remedy we are using in our practice as a clinical trial, and that medicine is Argentum metallicum. Any one of you using Argentum metallicum in your practice for joint pain? Jigar sir, are you there? Dr. Jigar Patel.
Yes, hello Manan, good morning.
Sir, are you there or not? Okay.
Hello.
Open Argentum metallicum. Argentum metallicum. We can prescribe the medicine from the affinity, guys. Argentum metallicum नहीं मिल रहा. ये फिजिकल बुक में बता, मैं ये डिजिटल होम्योपैथी से जरा दूर हूँ. Yes, Argentum metallicum having affinity, chief action. You can read it from the Poric, from the generalities. From the first para, third line, the chief action is centered on the articulation and their component elements, bones, cartilages, and ligaments. Now read it from Fata. Can anyone read it from Fata? Argentum metallicum. Yes, Argentum metallicum from Fata, fourth line. Secretion of mucous membrane are thick, gray, tenacious, like boiled scratch. It thickens the tissues, especially cartilages. So, guys, when there is affection of cartilage, we can think of this remedy, and that remedy is Argentum metallicum. So, when you are using Rustox, when you are using Pulsatilla, when you are using any kind of homeopathic medicine, along with that, you can think of Argentum metallicum in OA and in RA when the deformities are already present. This remedy have affinity on cartilages. Are you with me? Are you following me, guys?
Yes, sir.
Any question, any query? This is the remedy we are using in our practice as a clinical trial, and even you can think this remedy when there is cartilages affection. Even if I am not wrong, Argentum metallicum having a specific symptom downstairs gives aggravation. सर सीढ़ी चढ़ता हूं तो तकलीफ नहीं होती है, सीढ़ी उतरता हूं तब तकलीफ होती है. You can think of Argentum metallicum. You can think of phyto when patient is telling you, मैं सीढ़ी उतरता हूं तो नी जॉइंट पेन होते हैं. लिखा है फाइटो में, देखो फाइटो में अर्जेंटम मेटालिकम सर्च मिलना चाहिए. Back to RA. How to diagnose RA in practice? क्या करना है RA में, कैसे डायग्नोज करना है RA? Anyone? Yes. उससे पहले एक्सरे, RA में एक्सरे, that is for deformity. Yes, we have to check RA factor, anti-CCP bodies. Yes. See, guys, RA is the not indicated report. If RA is not positive, that doesn't mean patient is not suffering from RA. So those are patients who are suffering from joint pain and having RA negative. So they are called as a seronegative arthritic patient, or they are called as non-RA positive arthritic patient clinically. So RA factor is important to know. So we have to check RA to the patient. Along with that, along with RA, we have to go for CRP and ESR. If CRP and ESR is increased, which indicates patient having inflammatory condition, patient having inflammation in the joints or even in muscle. If you are treating the patient of RA, don't repeat the RA report frequently. Lekin every 3 months, check for CRP and ESR. If patient having increased CRP, and if patient is under your treatment, CRP must be reduced with medication. That is the clinical criteria. If patient is reduced symptomatically, that must be reduction in CRP with medication. If CRP is getting reduced, you can scientifically prove that homeopathic medicines are working on RA and it helps patient to relieve the pain. Even that shows in reports. Yes, ESR, CRP are a factor. Negative RA does not rule out RA. Arthritis is then called as seronegative arthritis. not common during the first year of illness and converting into seropositive status. तो initially 1 year के अंदर RA positive शायद नहीं आता है. That can be convert into RA positive after 1 year. So if patient came to you in initial 1 year and if RA is positive, don't get afraid. That is the common thing. ऐसा हो सकता है. And another report you can go for anti-CCP. Like RA factor, this testing is only positive in proportion of all RA cases. तो सबके अंदर ये पॉजिटिव है ऐसा जरूरी नहीं है, लेकिन you can go for the report. They are present in 70 to 80% of patient only. That doesn't mean हर एक patient को आता है. This is the RA. You can go for synovial fluid examination. RA के patient के अंदर जब swelling excessive होता है तो aspiration करके you can check for synovial fluid and which reveal the RA positive or not. And you can go for X-ray if the deformities are there. If you are treating the deformities, if patient get improved with deformity, you can check another X-ray to compare with the previous one. That scientifically reveal the thing that homeopathic medicines are working. Guys, nowadays, evidence-based practice is very much important. So whatever kind of case you are taking, yes, just take a record of that case that helps you in future to show the people, to show the authorities that you are taking such case and you are curing such case with homeopathic practice. So practice authentically and practice evidence-based. This is the need of today's era. Let's talk about remedies of RA, not specific for RA. Remedies for small joint pain. The basic remedy is colophyllum. We are frequently using this remedy, that is colophyllum, that helps in small joint pain, that helps in carpals, metacarpals, that helps in tarsals, metatarsals. So when patient came to you with joint pain, a small joint pain specifically, you can think of remedy that is colophyllum. Any specific modality anyone of you know for that colophyllum? Anyone? Colophyllum, are you using colophyllum in your practice? Even causticum is one of the good remedies that helps in patients of small joint pain. Colophyllum, extremities, severe drawing, erratic pain with stiffness in small joints, fingers, toe, ankle, etc. Aching in wrist, you can think of this remedy for wrist pain. Cutting pain on closing hand, erratic pain, changing place every few minutes. हर थोड़ी थोड़ी मिनट में पेन चेंज होता रहता है. And main thing, stiffness in RA or stiffness in small joint pain. You can think of colophyllum. And from some homeopaths, colophyllum is a immunomodulator. I have read some research on colophyllum and that reveals colophyllum is an immunomodulator. So you can think as a specific medicine for RA or in autoimmune disease with joint pain, which helps the patient a lot to reduce the pain and stiffness in small joint pain. Another medicine that is Viola O. One of my favorite remedy that helps in osteoarthritis or even in rheumatic arthritis or even in gout. Can anyone read viola O? Viola is also mentioned in comparison of colophylum. Viola O that is mentioned in comparison of colophylum, rheumatic carpal and metacarpal joints. And viola O, you can remember like this, O for ortho. So viola O is for ortho, for joint pain, and viola T is for skin affection. The specific modality, viola O having affinity, you can prescribe from the affinity. And another thing, viola O is deltoid affection. So viola O is medicine for right deltoid pain. Let's talk about shoulder pain. When patient came to you with shoulder pain or frozen shoulder or a simple deformity in joint or a restriction of shoulder pain, you can think of many remedies. And from the frozen shoulder, from the pain in the shoulder, you can rule out the diabetic mellitus. That is the specific symptom of chronic diabetes. डायबिटीज वाले बहुत सारे पेशेंट को फ्रोजन शोल्डर हो सकता है. And any specific remedy you know for frozen shoulder? First of all, you just rule out the patient. Is it simply shoulder affection or frozen shoulder from the symptom? If the movement is restricted along with the pain, then you can correlate it as a frozen shoulder. If the movement is not restricted, that is simply a shoulder pain. That is not the frozen shoulder. Right? If the movements are restricted with the pain, when you examine the patient, visual aa jao. Let me show you how to differentiate the pain. See, if the patient having pain in the shoulder, when you press this point, this is the typical point. This is the typical point where patient get pain. This is the frozen, that can be a frozen shoulder. And when you examine the patient and patient having pain over here, that is the typical deltoid pain, guys. This point, this pain is not the shoulder point. This pain is not the shoulder pain. This is the deltoid pain. So deltoid pain वाला patient आपके पास आएगा कि सर मुझे shoulder में pain हो रहा है. Patient के लिए shoulder और deltoid both are same. You have to differentiate the thing. So if you examine the patient having pain over here, so that is the deltoid pain. And when patient having pain over here, that is the shoulder pain. Shoulder pain can over here also, along with the cervical muscle pain. This is how you can differentiate joint pain from the muscular pain, from the location. It is quite difficult to differentiate. Thank you, Diswala. Please. It is quite difficult to differentiate muscular pain from joint pain in practice. When you examine the patient having local pain on the muscles, that is the typical muscular pain. When patient having pain on joint and with restriction of the joint movement, you can think of joint pain. So right shoulder pain, you can think of Sanken, you can think of Bryonia, you can think of Causticum, you can think of Chelidonium. For left shoulder pain, you can think of Ferromet, you can think of Sticta for both the joint pain. Sticta is more specific right side, again Sticta is mentioned in repertory in both the shoulders. These are the shoulder pain. Frozen shoulder specific medicine, believe me, that works. When patient is telling you, sir, मुझे shoulder में pain हो रहा है, and which is aggravation at night, रात को दर्द बढ़ता है. Any medicine? Any specific medicine you know, guys? shoulder pain, specific shoulder pain, which is aggravated at night. Yes, Mohit, you are absolutely right. The medicine is cifilinum. We are not using such medicines frequently, but guys, use it and you will get wonder in your practice. Believe me. Cifilinum is one of the best remedy for right shoulder pain specifically, which is aggravated at night. As it is syphilitic remedy, so pain aggravated at night. Lekin, let's read from Boric, cifilinum. Is it mentioned?
Was at night.
That is in modality. Okay. See, extremities, sciatica was at night, better about daybreak, rheumatism of shoulder joint का rheumatism at insertion of the deltoid के insertion में, run around, a severe pain in long bones, redness and rawness between the toe, rheumatism, muscles are caked in a hard knot and lumps, always washing the hands, indolent ulcer, muscular contracted in hard knot, in modalities, wars at night, modalities that matters, that helps differentiate the remedies. These specific remedy, shoulder pain, cifilinum, pain aggravation at night. Are you with me, guys?
Yes, sir.
Any question till now? Any confusion till now? Let's come to OA, osteoarthritis. That is the degenerative changes of cartilages, a progressive disease which is increasing with the age. Generally, we are getting geriatric patient with such condition. OA is generally involved weight-bearing joints. That doesn't mean that not affecting on the small joint. Especially OA is seen on knee and hips. And the third location of OA is toe or thumb. These are the common locations of osteoarthritis. These three common joints, hip, knee is very common and rarely thumb. And it is quite confusing when it is affecting on the toe or the thumb. It is get confused with gout. The most common affinity of gout is toe and small joint. What is happening in OA? What is the mechanism and pathophysiology of OA? Etiological factors, for example, weight is very much, age is affecting. In those patients, the body is trying to reversing it. That is the reversible matrix degeneration. In those cases, the condition is reversible. Body is attempting to repair it. If it is not about to repair it, unsuccessful, then it is causes degenerative changes. That is called as irreversible matrix degenerative changes. Accompanied with synovitis, उसके साथ साथ synovial जो membrane होता है उसके ऊपर सूजन होती है. उसके साथ साथ loss of cartilages होता है, cytokinase thing होती है, sclerosis होता है, and osteophytes formation होता है. And कई बार along with that loss of ligaments हो जाता है, that is called as progressive osteoarthritis. So osteoarthritis is progressive disease that increases with the age. So in those cases of osteoarthritis, we have to explain the patient. We are getting lots of patient of osteoarthritis, guys. In my initial practice, I have decided कि भाई मुझे ज़्यादा practice नहीं करनी है. I will just focus on geriatric patient और सिर्फ OA treat करो. If you only treat OA in your practice, you will get plenty of patients, guys. OA is very common nowadays, and people are afraid to go for operation. So I always tell that surgery is not the limitation of homeopathic science. Surgery is the scope of homeopathic science. So when you get the patient of OA, these deformities are there, these osteophytes are there. In those cases, you can treat the patient. Never claim that you can cure the osteoarthritis. Ask the patient, tell the patient, sir or madam, we are going to reduce the progression of OA and we are going to relieve the pain of OA. Our medicine will help you to reduce the pain. Our medicine is going to reduce the inflammation. Our medicine is going to reduce the swelling and your pain. Right? That is the OA. OA के अंदर what you see in X-ray. X-ray is the indication of OA. This is a report you can go for OA, that is X-ray. X-ray knee epilateral view. Always check for epilateral view. That reveals more specific thing. Osteophytes you seen in X-ray. That is the extra bone formation. So in osteophytes, what will be your prescription? If you see osteophytes in X-ray, so what will be your prescription? क्या होगा? Yes, Dr. Pit, Ruta. Can you show me osteophytes mentioned in Ruta? Anyone? Is it mentioned in book? Ruta में osteophytes है. Yes, I see calcarea floor. Yes, Dhanushya, one of my favorite remedy, that is Hekla lava. Yes, Bhumi, calcarea foss is there. Calcarea flow is the leading remedy for osteophytes, extra bone growth anywhere in the body. If it is there in OA, if it is there on skull, if it is there anywhere, even in jaw, even in calcaneus spur, you can think even over here on the wrist area, extra bone growth is there. You can think of calcarea floor. That is the leading remedy. Hekla leva is one of my favorite remedy. In those cases where the osteophytes are there, you can think of Hekla leva, open Hekla leva. See guys, I am practicing polypharmacy. So I am giving medicine according to symptoms, according to pathology. So along with calcarea floor, you can think of Hekla lava. Is it mentioned in Hekla lava osteophytes?
Exostosis mentioned.
Yes, what is exostosis?
Extra growth of
Yes, that is osteophytes. Both are same. Hekla lava. Marked action upon the jaw when you get the TM joint patient, always think of Hecla lava. It's an affinity on the jaw of great use in exostosis. Exostosis means extra growth of bone. That is also osteophytes, gum abscess, and difficult teething. So in those cases, you can think of this remedy, guys. Always think of Hecla lava for extra bone growth. Osteophyte, always think. Calcarea floor is the leading remedy. You can think of this remedy for extra bone growth. You can think of Argentum metallicum when patient having extra bone growth on a skull. Open Argentum metallicum. Argentum metallicum, there is mention extra bone growth on skull. आपके पास पेशेंट आएगा, सर यहाँ पे मुझे एक घुमड़े जैसा हुआ है, and when you examine that gumda or boil, that is the extra bone growth, that is not the actual boil. That is mentioned in Fatak, guys. Fatak Argentum metallicum, first paragraph, last third line, exostosis of the skull. That is extra bone growth in skull. You can think of remedy, that is Argentum metallicum. Are you with me, guys? और क्या होता है? स्क्लेरोसिस होता है. स्क्लेरोसिस क्या होता है? व्हाइट लाइन दिखती है एक्सरे में. मार्जिनल लाइन वी कैन फील. Irregular margins होती है. Along with that, narrowing of the joint space. So बहुत स्टूडेंट्स आके बोलते हैं कि सर मुझे एक्सरे देखना नहीं आता है. Guys, always check एक्सरेज. जब भी पेशेंट लेके आता है, एक्सरे देखते रहो. आपको पता चलेगा कि this space is reduced. If you check frequently, then and then you will get to know this is the normal space and this is the reduced space. In some patients, cyst formation is always there in X-ray. Cyst is seen little bit darker. Osteophytes, you know, that is the extra bone growth. तो जब भी space के अंदर extra bone growth दिखता है, that is osteophytes. Sclerosis, extra margins दिखती है, and space narrow होता है. Are you with me? These are the things we just feel in osteoarthritis patient. Activity के अंदर पेन होता है, वेट बियरिंग रिलेटेड होता है. जब भी बैठ के खड़ा होता हूँ, जब भी बॉडी का वेट आता है उसके ऊपर, तब पेशेंट को पेन होता है. रिलीव्ड बाय रेस्ट, रेस्ट करो तो अच्छा लगता है. स्लाइटेस्ट मोशन एग्रावेशन, लाइक कौन सी मेडिसिन है गाइस? स्लाइटेस्ट मोशन एग्रावेशन कौन सी मेडिसिन है? सर जरी सी मूवमेंट करूं और मुझे दर्द होता है, थोड़ा सा मूवमेंट करूं तो मुझे दर्द होता है. दैट इज ब्रायोनिया. यस श्वेता, यस आयुषी, यस भार्गव, यस बेलवेड, हिमांशी, काजल. दैट इज ब्रायोनिया. ब्रायोनिया की एफिनिटी कहां पे है? एनीवन नोज? एफिनिटी ऑफ ब्रायोनिया. ब्रायोनिया कहां काम करता है? गाइस, एफिनिटी ऑफ ब्रायोनिया, ब्रायोनिया म्यूकस मेम्ब्रेन और सीरस मेम्ब्रेन के ऊपर अफेक्ट करता है. तो यस, तो उसकी म्यूकस मेम्ब्रेन में क्या करता है और सीरस मेम्ब्रेन में क्या करता है? यस डॉक्टर डोला, म्यूकस मेम्ब्रेन, ओके. नीलाक्सी, साइनोवियल जॉइंट, ओके. यस नीलम, दैट क्रिएट्स ड्राइनेस ऑफ म्यूकस मेम्ब्रेन. तो जब भी रेस्पिरेटरी वाले पेशेंट आएंगे, उनके अंदर यू विल फील द ड्राइनेस. थ्रोट के अंदर ड्राइनेस होगा, नोज के अंदर ड्राइनेस होगा, खांसी भी ड्राई होगी. दैट इज द म्यूकस मेम्ब्रेन. So this is the question asked in my MD. मेरे MD के exam में they just asked me the question कि how Bryonia, and you know in your UG, that is good. Happy to hear that. It causes dryness on mucous membrane. It causes excessive secretion in serous membrane. Yes, Neelam, you are absolutely right. So we can think of this medicine in pleural effusion. We can think of this remedy in ascites. We can think of this remedy in synovial fluid, excessive secretion in joint. If there is excessive edema in joint due to excessive secretion of synovial fluid, you can think of Bryonia. OA के अंदर स्पेस कम होती है, लेकिन जब भी synovial fluid accumulation होता है, in those cases you can think of Bryonia. Believe me, guys, Bryonia works excellently when you are think of this remedy for serous membrane affection. You can think of this remedy in pleural effusion. You can think of this remedy in ascites. You can think of this remedy in synovial fluid accumulation. Anywhere in the body. It works as a diuretic. It works as a reduced synovial fluid. Bryonia 200 OD. You can think this remedy in higher potency. And believe me, it works excellently in 200% potency. Use it in your practice. Even when the patient came to you with X-ray, कि जिसके अंदर synovial fluid accumulation है, that is remarkably reduced in the synovial fluid accumulation. You can check in another X-ray after 15 days. Believe me, that works excellently. When you get the modality along with the symptom, along with the affinity, always think of Bryonia. Bryonia having slightest motion aggravation, Bryonia having typical thirst, excessive thirst, that is Bryonia. Are you with me? In OA, only one or few joints are only involved. Not like RA, many symptoms are affecting. Morning stiffness is there. That is also in RA. Restricted functionality, तो movement restricted हो जाती है. Capsular thickening होती है, that is why. And due to osteophytes, the movement are get restricted in OA. CMC joint, that is, what is CMC joint? Anyone? Which is generally mentioned in X-ray.
The
CMC
carpometacarpal
joint
joint.
affected. वो X-ray में लिख के आएगा. You have to know what is CMC, carpometacarpal joint. So you have to aware with such terminologies. Carpal metacarpal joint के अंदर affection हो सकता ही नहीं हुए. It is not common, that is rare, लेकिन that might be. So when there is affection in wrist, we have good remedy, that is, कौन सी medicine है? Wrist affection. While O is there, another remedy. Colophyllum, another remedy. Yes, Neelam, that is Actia spicata. Yes, Veda, that is Actia spicata. One of the best remedy. When you get the inflammation, when you get the affection on wrist, never forget to prescribe this remedy. Never. Yes, Ruta is always there. In this specific remedy is Actia spicata. While O is always there. Yes, benzoic acid is there. Yes, Nilaxine. In this specific remedy is Actia spicata. Actia spicata is more on right side. You can think this remedy for both the side when patient having pain on wrist. How to diagnose OA? Check for blood report. Blood report में से कहाँ पता चलेगा OA है या नहीं है guys? Anyone? OA में कैसे पता चलता है? एक्सरे पे या फिर ब्लड रिपोर्ट्स पे? एक्सरे इज देयर, लेकिन ब्लड रिपोर्ट्स पे से कैसे पता चलता है? उसमें नॉर्मल हो सकते हैं. If patient is suffering from joint pain and if all the reports are normal, RA is normal, ESR is normal, CRP is normal, so if the reports are normal, we can consider it as a OA. CRP and ESR बढ़ सकता है, लेकिन if the reports are normal, you can think of OA. That is why we have to go for blood reports. Blood reports are helpful to differentiate from RA. If RA is negative, we can think of OA. Seronegative RA is there. From the concluding joint pain, RA is negative, or blood reports CRP and ES are negative, we can think of OA. That is why blood reports are required in OA. Synovial fluid is analysis is required. One CPPD report is there, that is calcium profilate dehydrate crystal deposition is there or not. According to that, that is the synovial fluid analysis. उसके ऊपर से पता चलता है. Calcium phosphate is there or not, उसके ऊपर से पता चलता है. These are the things for RA and OA. OA के अंदर symptomatic symptoms, systemic symptoms are not present. RA के अंदर fatigueness, general weakness, tiredness is always there. So systemic symptoms are involved, then we can think of RA. Only particular local local joint is affected, that is OA. More specific in OA and RA, morning stiffness is present less than 30 minutes, that is OA. And if it is remaining more than 1 hour, that is RA. That is the theoretical thing, guys. Morning stiffness is always present in both the things. Again, more specific, less than 30 minutes to 60 minutes, that is OA. More than 1 hour, that is RA. Generally, OA occurs in old age, in geriatric patient. Generally, RA is present in teenage, or that is near to 20 to 35. Most common age group, that is 20 to 35 or 25 to 35. In RA, RA factor might be positive, anti-CCP might be positive, CRP or ESR might be positive. Lekin in OA, in OA symptom, RA factor is negative, anti-CCP is negative, and ESR and CRP might be negative. In OA, movement increases the pain. So Bryonia is more prominent in OA, and in RA, movement decreases the pain. That is RA. So that is Rustock's kind of pain. So we can differentiate our medicine. हमारे पास जब भी पेशेंट आता है तो we are not differentiating OA and RA. We are differentiating Bryonia and Rustock's. जब भी एक पेशेंट को I got a call from one ICU. I would like to give one example of severe case of some severe disease. मुझे ICU में से एक कॉल आया था, एंड वो एक होम्योपैथ की इज्जत बचाने का कॉल था. I got a call from one ICU center before 5 years or 6 years. I don't remember the exact year. मेरी मेमोरी ज़्यादा अच्छी नहीं है, especially for time. तो I got a call from ICU कि हमारे पास एक पेशेंट आया है जिसने एक होम्योपैथिक मेडिसिन ली थी और उसके बाद उसका जॉइंट पेन इतना बढ़ गया है, नाउ पेशेंट इज एडमिटेड इन हॉस्पिटल. As we are running homeopathic clinics since many years, so local doctors are known us since very long. So orthopedics were known to us, and patient was admitted due to the after taking homeopathic medicine and get severe pain in joint. This is the clinical case, and I got a call from the ICU center. So वो डॉक्टर का नाम तो मैं नहीं बताऊंगा, लेकिन दैट डॉक्टर इज वन ऑफ माय गुड फ्रेंड. जो मैंने उसको ये बोला होता बिफोर, तो ही गेट स्कैर्ड कि ऐसा भी हो सकता है. आई शेयर सच थिंग टू हिम, लेकिन आफ्टर द इंसिडेंट्स आई शेयर इट टू हिम. नाउ आई गॉट अ कॉल एंड आई विजिटेड टू ICU setup. So there is no history of joint pain before. उसको कोई joint pain नहीं था. And as you all know कि homeopaths are not showing a prescription, तो कौन सी मेडिसिन ली थी वो हमें पता नहीं था. लेकिन पेशेंट ने, कोई डॉक्टर ने प्रिस्क्राइब किया, पेशेंट ने दवाई ली एंड गेट सीवियर जॉइंट पेन. नाउ दैट इज अ क्रिटिकल थिंग. जो मैं वहां पे बोल देता कि भाई ये मेडिसिन लेने के बाद हुआ है, तो हमारा साइंस गलत हो जाता कि होम्योपैथिक मेडिसिन हैविंग side effects. So I write down on the paper, I write down on the case paper, if patient is very much sensitive to such homeopathic medicine, patient is hypersensitive to such medicine, and that is why patient having affection. So I didn't mention कि patient having a side effect of such medicine. I mentioned that patient is hypersensitive to some medicine. Patient is idiosyncrasy. So idiosyncrasy, they are not aware with such terminology. So I mentioned in diagnosis that patient is hypersensitive to such medicine. Some homeopathic medicine, we are not aware with the medicine. So patient might be sensitive to some such homeopathic medicine, and that is why that occurs. I am sharing you my clinical experience, and that is the real experience, guys. At that time, homeopathy की इज्जत का सवाल था. I didn't pay for that visit also. लेकिन such incidents occur. And at that time, if you get some call from another homeopath or another hospital, never criticize homeopathy or never criticize any homeopath, guys. This is what you have to learn in your practice. Or in the next moment when I left the hospital, I just called that doctor कि भाई आपके पेशेंट में ऐसा हुआ था. He just shocked. मेरे पेशेंट में भी हो सकता है, कोई भी होम्योपैथ के पेशेंट में हो सकता है, लेकिन that is the real incidents. Plastox दिया होगा, Bryonia दिया होगा, whatever, मुझे नहीं पता है. I didn't ask the medicine to that doctor also. लेकिन वो होम्योपैथ की इज्जत का सवाल था. And I saved the इज्जत of homeopaths. I really feeling proud for that. Back to topic. Another thing that is confusing with OA and RA, that is gout. Gout is most commonly seen in our practice. Gout is most common inflammatory disease caused by anyone? Yes. क्या होता है gout में? Anyone knows?
Uric acid deposition.
Anyone? Yes, increased uric acid. Okay. uric acid deposit. Okay. Hyperuricemia. Okay. Yes, you all are absolutely right. Gout is a metabolic disorder caused by deposition of monosodium urate crystal in joint and tissue, followed by chronic hyperuricemia. ये difficult word ना जानना हो, ना बोलना हो, you can simply say uric acid बढ़ जाता है, and that is why gout is occurring. Gout is a metabolic disorder of purine that occurs due to purine metabolism, characterized by intermittent attack of acute pain, with swelling, with inflammation. If you seen any patient of gout, पेशेंट को सीवियर इन्फ्लामेशन होता है, और आपके पास जब भी पेशेंट आता है गाउट का, तो पेशेंट केम विद एक्सेसिव स्वेलिंग, स्पेशली गाउट अफेक्शन ऑन टो, that is the common affinity of gout, especially affection on small joint, especially on toe, you can think of gout. Are you with me, guys? It always specified by increased uric acid or hyperuricemia. What is the common criteria or common range of uric acid, guys? Anyone? Uric acid below? Yes, Arpit, below 7, okay. Basically, there is below 6, but nowadays criteria is quite changed. If it is increased more than 7, or if it is near to 8, but patient is asymptomatic, they are not treating the patient. Okay, nowadays we are getting many patients having uric acid around 7 or 8, and they are asymptomatic. So there is no need to treat such patient. But if it is symptomatic, even 6.5 uric acid symptomatic, we have to treat such patient. That is the clinical approach. Patient ने body profile करवाया है, along with that uric acid is 7 or 8. Although patient is asymptomatic, don't treat them, no required to treat them. Simply advise dietary advice that helps to the patient in gout cases. So hyperuricemia due to excessive uric acid production or decreased excretion. Deposition बढ़ता है और excretion कम होता है. Purine synthesis एक mechanism होती है जिसमें due to many causes, तो उसमें decreased renal excretion में कौन से causes हो सकते हैं? Renal failure हो सकता है, lead poisoning हो सकता है, excessive consumption of alcohol, that is a lifestyle disorder. If I am talking about vinology, especially beer is affecting to the patient. तो आपका कोई friend है who is alcoholic or who is taking alcohol and having excessive uric acid, बोलो उसको कि beer मत लो, you can take vodka, you can take minimal amount of whiskey, but beer is contraindicated specifically in gout. Drug diuretics, some diuretics having side effects. Methotrexate or any, if patient is taking any that steroids, so that can be create increased uric acid. Even Down syndrome के अंदर भी uric acid बढ़ता है, और in some cases unidentifiable cases जिसमें etiology कोई नहीं होती है, in those cases we are getting gout. और किस के some cancer of chemotherapy, patient is on chemotherapy जिसके अंदर भी uric acid बढ़ सकता Obesity is one of the cause, one of the triggering factor or risk factor we can consider. Kidney disease are there. Decreased renal clearance, मतलब कोई drug के ऊपर patient है, any hypertensive medicine that affects, or aspirin is one of the thing that affects. Genetical factor can be there. 90% के अंदर kidney affection होता है. These are the basic things that affects in gout. So gout में dietary advice क्या देनी है? That is very much important in gout patient, in gouty patient. So what will be your advice in gout patient? क्या advice करना है?
Low protein. Red meat, chicken.
Yes, protein intake कम करना है. Protein intake में क्या क्या आता है? Yes, Saili. Yes, Bhumi. Yes, Bhargav, non-veg, pulses, eggs, all type of dal. Yes, pulses. These are the common advisory. You can give more specifically. Non-veg के अंदर avoid to take meat. Meat नहीं खाना है. Having excessive protein in that. Beef नहीं खाना है. You can say specifically. Even seafood having excessive protein, so that must be avoided. Seafood avoid करना है. Alcohol, if patient is taking, specifically beer, must be avoided. Non-veg के अंदर you can say liver, kidney और brain avoid करना है. Organ meat के अंदर. These are the non-veggies. और pulses, सब प्रकार की दाल you can avoid. According to one theory, जो मूंग दाल होती है, मूंग होते हैं, that can be take by the patient. लेकिन if uric acid is increased, patient को बोलो कि मत ही लो, if it get controlled. जो दाल लेनी है तो दाल के ऊपर का पानी लीजिए, दाल मत लीजिए. If patient is obsessed with the दाल, उसको चाहिए ही, तो ऐसे एडवाइस करो, ऊपर की दाल ले सकते हो. Avoid to take पनीर, सोयाबीन नहीं लेना है, excessive source of protein. तो that must be avoid, वो avoid करना है. different stages होते हैं gout के. Stage 1, that is high uric acid level. The uric acid is building up in the blood and starting to form the crystals around the joint. That is the stage 1. Stage 2, that is the acute gout. Patient acute pain लेके आता है, सर मुझे कल से ही severe pain हुआ है. Symptoms starts to occur, causing painful gout attack, that is called as gout attack. The third stage, that is interfacial gout, the period of remission between the gout attack, उसके बीच में अच्छा हो जाता है, patient को symptomatically relief मिलता है. The fourth stage, that is the chronic gout. So gout pain is frequent and toffee form in joints. Crystals create हो जाते हैं. It is called as toffee. कैसे diagnose करना है? Generally clinically diagnosed and from the uric acid. Uric acid check कराओ. Even in severe cases, you can go for synovial fluid test. आप करवा सकते हो. Always check for creatinine. And nowadays, they are believing कि along with the uric acid, patient having complaints of renal issues, so that is the we can consider is a uric acid diathesis. तो uric acid diathesis वाले जितने भी medicines हैं, that we can consider in this gouty rheumatism, that is gout. Yes, that is called as toffee. TOPHI. You know. Sorry. What are the medicines in allopathic science they are using? Anyone? Colchicine. Colchicum we are using, that is in homeopathy. They are using colchicine and allopurine. Colchicine is remedy used in allopathy science, and simultaneously the same name we have, that is colchicum. Most commonly used remedy, that is colchicum. What are the symptoms of colchicum? Anyone? For gout, colchicum. Anyone?
Lightness and aggravation.
Yes, Bhargav, Fabustate. Anyone? Symptoms of colchicum. How will you diagnose colchicum in your practice? This one as well. Again, demonstration. Yes. Cannot touch or move. Screams on touch. Yes, Bhargav. Touching aggravation. See, what is the differentiating point between arnica and colchicum? When patient having pain over here, if it is gout or whatever it may be the condition, patient having pain over here, when you are going to examine the patient and when you touch the patient, patient just scream. When patient having simple touch to the surface and getting pain and patient scream, that is colchicum. And what is arnica? That is fear of approach. When you are going to touch to the patient and not even touch patient scream. ऐसे जैसे आपने टच नहीं किया, all the patient scream. तो आर्निका के पेशेंट को you can make fun with आर्निका patient. ऐसे पेशेंट ऐसे रिएक्ट करेगा. Even you are not touched to the patient. That is fear of approach. Fear of touch. That is arnica. This is the differentiating point between the pain of arnica and colchicum. When you touch, patient scream, that is colchicum. Sir, बहुत दर्द है, मत touch करो. And when you going to approach, ऐसे touch करने गए और चिल्लाता है, नहीं 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 sir, मत touch, नहीं 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 sir. That is arnica. Before touch, fear of touch, fear of approach. That is arnica. That is the differentiating point between colchicum and arnica. When colchicum fails in gout, always think of benzoic acid. Benzoic acid is one of the best remedy as a complementary to colchicum in gout. Even in nodosities of gout, you can think of this remedy, that is benzoic acid. Are you with me? Guys, colchicum is one of the leading remedy. When patient is complaining you in the great toe, sir, great toe में बहुत pain है. Another specific remedy, that is Bothrops. Bothrops is not generally used for gout, but this is the remedy you can think. Open Bothrops, guys. We are frequently using this remedy. Bothrops. Excessive pain on great toe. Bothrops is Ophidia group remedy. Or there are network issue. Am I audible, guys? Am I clearly audible? Margi. Now am I audible? Bothrops, there is mentioned in generalities, pain in right big toe. When patient came to you, sir, मुझे specific right side big toe में pain हो रहा है. always think of both arms and simply prescribe both arms. That gives relief to the patient. Bothrops, use it in your practice. Swelling, swollen है, red लग रहा है, along with colchicum, you can think of bothrops. Even guys, colchicum, that is one of the contraindication of homeopathy. Try to avoid colchicum in cardiac patient. Don't repeat colchicum in cardiac patient a lot. Colchicum having some culprit affection on cardiac patient. That is, we have seen clinically. I'm not telling you each and every patient of cardiac get affected with colchicum, but be a caution when you are using colchicum in cardiac patient. Colchicum having some affinity on cardiac region, cardiac affection. So try to avoid, frequently repeated colchicum in cardiac patient. This is what we have seen clinically. That is not mentioned in any book. This is what we have seen clinically. And one more thing that is mentioned in Kant, never get afraid when you prescribe colchicum and patient having cloudy urine, or patient having turbid urine, or patient having some crystals in urine. That is mentioned in Kant. When you are using colchicum, on the next visit, patient will tell you कि सर आपकी मेडिसिन यूज करने के बाद मेरा यूरिन बहुत गाढ़ा हो गया है, या मेरे यूरिन में कुछ क्रिस्टल्स आ रहे हैं, या मेरे यूरिन थोड़ा क्लाउडी हो रहा है. That might be due to the efficacy of colchicum. Uric acid is excreting out. And if patient come to you and telling you in next visit that colchicum के बाद urine में changes आया है, तो it shows medicine is working. That is the confirmatory symptom that uric acid is excreting out with the use of colchicum. Are you with me? These are the clinical approach. These are the clinical things. Are you with me? कई बार गाउट के जो अटैक्स आते हैं, those are remain for some days, उसके बाद अपने आप चले जाते हैं. So that doesn't mean कि आपकी मेडिसिन काम नहीं करती है. That is also self-limiting. लेकिन we have to treat such patient when the attacks are there. That remains for 2 to 3 days, or in some patient that remains for several weeks. And that pain followed by asymptomatic phase, or that is called as a intercrucial period or remittent period, that is diagnostically important कि वो gouty ही है. In chronic gouty arthritis, crystal deposits appears in cartilages. तो synovial membranes के अंदर, tendons के अंदर, soft tissues के अंदर it affects. And the classical location is of tophus is a helix. Helix मतलब that is the great toe. And anti-helix of the ear मतलब वो क्या है? What is anti-helix? Anyone? Helix is great toe. Anyone? Yes, Neelam. Sir, have never heard or read anywhere, but one layman once told me that arnica should never be prescribed in patients who have had a history of dog bite in past. Is it true? Dog bite में नहीं देना है. I've never heard it or never read it. The patient को कुछ Sorry?
White coat, mention a white
Huh. That curve in ear, that is called as antihelix. So gout के अंदर भी that can affect. So we can think of colchicum and our other remedies. Onset may be insidious or suddenly होता है. Metacarpals, metatarsals mostly affect होता है. Great toe firstly attack होता है. 70% patient में great toe ही affect होता है. Even knee, ankles are also affecting. When knees are affecting from gout, you can think of phytolacca. Phytolacca is one of the good remedy when patient having affinity from gout, especially affection of knee. Affected joint can be hot, can be red, can be swollen, with shiny thing. Shininess you can observe from the joint. Painful होता है, tenderness होती है, and that can be affected with anorexia, associated with anorexia, with nausea, with fever sometime, and increased ESR with leukocytes. Leukocytosis, I meant to say. Are you with me, guys? This is the typical gout. Any doubt between RA, OA, and gout? I hope after these sessions, we can differentiate these most common conditions of joint pain in your practice. Any question, any query till now, guys? There's one question from Danusha. Some teenage patients have capitals in knee. Can we try Argentum metallicum? Yes, definitely you can think of Argentum metallicum. And any other medicine? Capitals in knee. Capitals in joint. Any medicine, guys?
Letting of oil in joint.
If I'm not wrong, the remedy is Guec. Capitals in joint, you can think of Guec. Guecum is one of the good remedy for gouty pain, for joint pain, especially if the affection is in toe or in thumb, you can think of Guecum. Rheumatic pain in shoulder, arms, hands, and growing pain. Anyone of you know what is growing pain? When we are talking about pain, what is growing pain? Anyone know? What is growing pain? GRWING. Growing pain. Yes, Danusha, that is increasing in intensity. No. Gradually increasing. No. Yes, Arpit, Dr. Arpit, in children. So what is that? What is growing pain? Yes, Dr. Jigar Patel. Happy to hear you from your side. Teenagers, or especially in children, when their bones are growing, they get pain at that time. So आपके पास जितने भी बच्चे आते हैं और joint pain की complain करते हैं, in those cases, pediatrics are telling them कि calcium deficiency है. Calcium deficiency can be a cause, लेकिन when patient is telling you having pain on thigh, having pain in long bones, that might be a growing pain. And believe me, guys, in growing pain, you can think of Guecum and another specific remedy which is already mentioned in Guecum in brackets, that is acid phos. Teenage बच्चे या entering in teenage, in those cases, in those age, when patient having growing pain, you can think of acid phos, you can think of gout. That is the growing pain, not in the region of growing, not increasing intensity. That is growing pain in children. People are taking different terminologies, different meaning of that growing pain. So this is the gouty, tearing and contraction, immobility, stiffness, ankle pain extending up to the leg, causing lameness. Can bear no heat, heat से tolerate नहीं होता है. And when patient is telling you, सर मुझे बर्फ लगाने से अच्छा लगता है, any kind of pain guys, OA है, gout है, या फिर RA है, whatever it may be the cause. When patient is telling you, sir मुझे बर्फ लगाने से अच्छा लगता है, what will be your prescription? Anyone? Icy cold application gives amelioration in joint pain. Always think of Radium. One another modality of Radium is vapor thing gives amelioration, which is mentioned in Kent. Vapor thing, that is balm, that is Vicks, that is Iodex. जब भी मैं balm लगाता हूं और gives me relief, that is Radium. Vapor things gives amelioration. Icy coldness gives amelioration. मैं बर्फ वाली बाल्टी के अंदर पग रखूं और gives me relief, that is Radium. That is the typical Radium. If vapor thing gives amelioration in respiratory complaint, that is ammonium carb. Vicks or balm gives amelioration in respiratory complaint, that is ammonium carb. And if joint pain is amelioration with vapor thing, think of Radium. One question from Selva. In old age patient, even well-selected remedy cannot improve the condition of OA. How to manage that? Yes. This specific remedy for OA from my side is Kali iode. Open Kali iode, guys. Open Kali iode from Borik. Kali bichromicum is always there, but along with that, you can think of Kali iode. Typical night modality have Kali iode, have that is syphilitic remedy. So destruction is there. So in those things, you can think of Kali iode. Let me open Kali iode. Can anyone read Kali iode from Borik?
बोरिक में नहीं है सर.
Iodide of potassium. That is mentioned as a Kali hydrodicum. That is Kali iode. Yes. Severe bone pain, periosteum thickened, especially tibia, sensitive to touch, that is Kali bichromicum and asafoetida. A rheumatic pain at night, especially at night, guys, in damp weather, as it is Kali, damp aggravation, contraction of joint, rheumatism of joint with effusion. If it is infused or not, you can think of this remedy. Pain in small of back and coccyx, pain in hip, forcing limb, sciatica, cannot lie in bed, worse at night, night aggravation, and lying on affected side. Affected side पे सो जाए तो बढ़ जाता है. Formication of lower extremities when sitting, better lying down. This is the specific medicine for OA knee. और ओएनई के अंदर काली आयोड के साथ साथ यू कैन थिंक ऑफ सेल्वा डॉक्टर सेल्वा, यू कैन थिंक ऑफ ऑस्टियोआर्थराइटिस नोसोड. Even you can give medorinum as a specific complementary medicine. See guys, you cannot cure OA. Patient को relief करना है. For giving relief, you can think of these different remedies. When patient came to you having acidity along with OA, think of calibacromica. Acidity, epigastric tenderness. सर खाने के बाद तुरंत पेट में दर्द होता है, कौन सी मेडिसिन है? Suddenly after eating, abdominal pain, that is calibacromicum. 1 hour after eating, that is nux vomica. तो गैस्ट्रिक पेन के साथ, गैस्ट्रिक एसिडिटी के साथ, when patient came to you with ONE, think of calibacromicum.
Sir, Kali
Even
iode.
Sticta is the specific medicine for knee joint pain, फिर ONE, specifically on left side. That is the medicine for house-made knee, like sepia. बहुत घर में काम करते हैं, हाउस मेड की तरह घर में फीमेल काम करती है, या फिर हाउस मेड है, वॉट एवर इट मे बी, यू कैन थिंक ऑफ स्टिक्टा. This is how we can give medicine to the patient. That is called as pain management. Patient को relief करना with our medication. When there is no pain, I always say chamomilla is the indicated remedy. When there is pain with numbness, tingling, always think of chamomilla. With irritability, with sleeplessness, always think of chamomilla. One of my favorite remedy. There is no doubt it works in no pain. One of the best nerve pain remedy in world. No other medicine in allopathy science, allied science that helps in nerve pain. Pregabalin is there, methylcobalamin is there, but no other specific medicine for nerve pain. You can think of chamomile. Let's back to sciatica. Sciatica occurs from the compression of sciatic nerve due to compression at the lumbar region. That might be compression between L2, L3, L4 or L5 or between S1, anywhere. You can differentiate the pain from the location of the pain. You can tell the patient कि आपका compression कहाँ पे है, guys. If the pain of sciatica, generally pain of sciatica begins from back, it going to the lateral side of thigh, it goes to lateral side of lower limb or below the knee, and it ends on toe or in little finger. This is the common location of sciatica. When patient is telling you, sir, मुझे back pain के साथ pain सिर्फ knee तक जाता है, then you can tell the patient compression might be between the L2, L3 and L4. If pain is reducing, a pain is going below knee, the compression might be below L4, L5 or between L5 and S1. This is how you can differentiate pain and you can judge the compression from the pain. Are you with me, guys? You can tell the patient, let's go for X-ray. मेरे हिसाब से यहाँ पे compression आएगा. Let's check for CT scan. मेरे हिसाब से यहाँ पे compression आएगा. From the pain, you can differentiate from the location of the pain where the compression is. That creates confidence in the patient. इस सर ने बोला था कि यहाँ पे compression आएगा तो वहीं पे आया. You can confidently say to the patient, let's check for the X-ray. यहाँ पे compression है. SLR test is there. When you examine, when you ask the patient to lie down and you just raise the leg, patient gets pain after almost 30 degree up. Patient को pain होता है. That pain occurs on the back side, lower back, that is called as SLR positive. That is the clinical sign of sciatica. Check it. Patient को examine करो. If patient is telling you, I have pain on anterior thigh, guys, that is quite different from sciatica. That is crural neuralgia pain. Crural neuralgia is quite different than sciatica. You can consider it as a sciatica, lekin more specifically, if you are dealing with some orthopedic, when you are dealing with some rheumatic doctor, or some allied science doctor, an MD physician, you can tell them that is crural neuralgia. Crural nerve begins from hip region and that radiates to the anterior thigh. Let's move towards the anterior thigh. When patient having anterior thigh pain, think of crural neuralgia. That is quite different from sciatic pain. Cause might be in the pelvic region. That might be ovaries in female. That might be anything in pelvic region. If crural neuralgia is there, if the anterior pain is there, think of xanthoxylum, think of staphysagria, think of nephelium, even think of TBP. And we have seen in Sabina. Even belly sp is there for anterior thigh pain. When we are talking about sciatica, typical left side sciatica, we have excellent remedy, that is colocin. You can use, yes, Neelam, TBP is Therapy Bursa P. That is due to dysmenorrhea, anterior thigh pain. Due to dysmenorrhea, when patient having pain on thigh, you can think of xanthoxylum. We have two remedies, one is xanthoxylum, one is xerophyllum. I'm talking about xanthoxylum. Even xanthoxylum is one of the good nerve remedy that helps in patient of diabetic neuropathy. Open your xanthoxylum from Fata. डायबिटिक न्यूरोपैथी वाले जितने भी पेशेंट आपके पास आते हैं, ये उनकी कॉमन कंप्लेन होती है कि सर मैं गद्दी पे चलूं या रूह की गद्दी पे चल रहा हूं या कॉटन पे चल रहा हूं, ऐसा लग रहा है. आर यू गेटिंग सच पेशेंट? आपको मिलते हैं ऐसे पेशेंट या सिर्फ मुझे ही मिलते हैं? गाइस, आते हैं ऐसे पेशेंट इन योर प्रैक्टिस? Open xanthoxylum from Fata. Last line of xanthoxylum Fata. Floor feels soft like wool on walking. गद्दी जैसा फील होता है, वूल जैसा फील हो रहा है, whatever it may be the sensation. That might be due to nerve pain, that might be due to neuropathy, diabetic, non-diabetic neuropathy. When patient gets such sensation, you can think of this remedy, that is xanthoxylum. You can think of chamomilla in diabetic neuropathy. You can think of kali phos in diabetic neuropathy. Along with that, you can think of acid phos in diabetic neuropathy. It's the specific remedy. Nerve management. When patient is telling you, so I have burning in my soul due to diabetic neuropathy or without diabetic neuropathy, you can think of sulfur. You can think of chamomilla. These are 3 common remedies which helps frequently to the patient. Soles में जलन हो रही है, मुझे पानी में पैर रखने पड़ रहे हैं. Think of sulfur, think of chamomilla. Even lycopodium is there, having burning in soles. Even Sanken in that typical age group, when patient having hot flushes, having burning sensation in soles. In that typical age group near to 40 menopausal age, think of Sanken. Are you with me? Are you following me, guys? ये सब ऊपर से जा रहा है.
Yes, sir.
These are the practical things. These are the practical approach. You can think of these practical remedies in your practice. Colocin is the leading remedy. You can think colocin 1 mTDS in sciatica patient. You can think of xanthoxylum specifically on left side sciatica when pain is associated with numbness and tingling. Yes, Neelam, what is your question? Yeah. Should directly go for MRI or X-ray? Check first with X-ray. If patient having clinical symptom of sciatica and if patient is not responding with medication and X-ray is not revolving thing, then you can check for MRI. करवाओ check. सब करवाते हैं तो हमें क्यों नहीं करवा? Definitely you can go with MRI. लेकिन पेशेंट को बोलो कि आफ्टर एमआरआई लाइन ऑफ ट्रीटमेंट विल रिमेन सेम. आफ्टर एमआरआई हमारी मेडिसिन चेंज नहीं होने वाली है. सिम्टम्स आर रिमेन सेम, मेडिसिन आर रिमेन सेम. तो खोटा खर्चा नहीं करना है, अननेसेसरी एक्सपेंस नहीं करना है टू द पेशेंट. If patient is educated, if patient is over possessive, if patient is insisting to you to go for MRI, go for it. Lekin that will not change our line of treatment. Yes, definitely, Neelam, to rule out the surgical need. If hernia is there, there is no reversible there is not a reversible pathology. If age is near to 30 or 40, you can go for surgery. Lekin we are here to prevent the surgery. Here is a homeopath. I personally not advised to go for spinal surgery. There are lots of complications in spinal surgery. If age is there 60, 70, don't advise to go for surgery. If age is 30 or 40, if the bulging is there, don't go for surgery. If herniation is there, go for surgery. Otherwise, try to avoid the surgery, especially spinal surgery. For right side affection in spinal, in sciatica, think of McFoss, think of Gnephalium. Gnephalium is one of the good remedy for right side sciatica. Yes, Dhanushya, sir, you suggest on using mother tincture. I am not personally using any mother tincture, so I personally not advised to use any mother tincture. I am giving potentized medicine only in my practice, so I personally advise to go for potentized medicine. Even tellurium is one of the medicine that helps in right side sciatica. One of the good remedies. When you are not responding good with colocin, you are not responding good with McFoss, you are not responding good with that Gnephalium. Think of tellurium. Having right side sciatica pain. one of the good remedy, that is valeriana. Open it. Valeriana. People are using this valeriana sometime in mother tincture. A person using in potentized form. Do you get the medicine?
Sciatica pain was standing and resting on floor.
Valeriana. Having typical modality, guys. क्या है? Read करो जरा.
Sciatica pain worse, standing and resting on floor, better walking, pain in heels when sitting.
मुझे क्या नहीं मिला. हाँ.
Limited.
Sciatica pain was standing and resting on floor. जब पेशेंट आपके पास आता है कि सर मुझे खड़े रहने से साइटिका में पेन होता है, मैं आधा घंटा भी खड़े नहीं रह सकती हूँ, think of two remedy, that is valeriana, and another remedy, that is ammonium mure. Sciatica worse on standing. Now, how to differentiate these two remedies? When sciatica aggravation by standing, which is ameliorated by lying, which is ameliorated by walking, walking करने से अच्छा लगता है, then remedy is valeriana. And lying down amelioration, think of ammonium mure. निकालो ammonium mure.
Sciatica worse, sitting chair.
Ammonium mure. निकालो. फटाफट.
Sciatica worse, sitting, better lying.
और modalities में
Open air, amelioration, worse, head and chest symptoms. Sciatica and modality में worse sitting and better lying.
in general.
In general, better by open air, worse by head and chest symptoms in the morning, abdominal symptoms in the afternoon.
So that is sitting and standing. Both are affecting to ammonium mure. Where is ammonium mure? Yes. Sciatica was sitting, better by lying. तो जब भी बैठने से लंबा बैठ नहीं सकता हूँ, लंबा खड़ा नहीं रह सकता हूँ, then think of these two remedy. Sitting aggravation, even valeriana में भी sitting aggravation है, तो खड़ा नहीं रह सकता हूँ या लंबा बैठ नहीं सकता हूँ, think of these two remedy and you can differentiate these two remedy. Amelioration by walking like Rustox gives valeriana. Amelioration by lying down floor के ऊपर सो जाओ तो अच्छा लगता है, think of ammonium mure. Are you getting my point? Are you getting my point? Are you with me, guys? Raise your hand. आज सब ठंडे ठंडे लग रहे. सैटरडे नाइट पार्टी नहीं की ना किसी ने ज्यादा. लग तो ऐसा रहा है, ड्राउजीनेस वाले. Be energetic, guys. Homeopaths must be with lots of energy. आप क्लिनिक पे जाओ तो फुल एनर्जी के साथ जाना है. आप तो 2-4 को पार देना है, ऐसी एनर्जी चाहिए.
Surgical last patient will be same energy.
हाँ,
So the last patient will be same energy.
वो एनर्जी के साथ ही बैठना है. Even guys, ammonium mure is one of the good remedy for neuralgic pain after amputation. डायबिटिक फुट वाला पेशेंट आया जिसको एम्पुटेशन किया है, और in those cases when you think of hypericum, when you think of belly spine, Along with that, think of this remedy, that is ammonium mute. Even according to Rizwana, ileum cepa is almost there. Ulcerative pain in heel, we are thinking of ammonium mute. And after amputation, when neuralgic pain is there, think of ammonium mute. Along with hypericum. Hypericum, we all know, is one of the good nerve remedy. So when nerve pain is there, when a rupture of nerve is there, think of hypericum. आपके पास कोई बच्चा आया जिसकी उंगली में लग गया है, जिसकी उंगली में ब्लंट इंजरी हुई है और उसके साथ नर्व इंजरी हुई है, थिंक ऑफ hypericum. टिश्यू के साथ साथ नर्व डैमेज भी हुआ है. ये जो ओपन डोर होता है, वो जो क्लोज डोर हो जाता है अपने आप, उसके अंदर when patient get crushed their finger, even window के अंदर crushed their finger, that is very common in practice. In those cases, along with arnica, along with ledampa, think of hypericum when there is nerve injury. Are you with me, guys? Any question, any query till now? When patient is telling you, "Sab mujhe calf muscle pain ho raha hai," that is the bread and butter of GP practitioner. Calf muscle pain. What are the causes of calf muscle pain? Vitamin B deficiency, yes, Bhargav. Then dehydration. Yes, Arpit, nowadays magnesium is in trend. Low magnesium. Low sodium. Increased potassium. Potassium बढ़ने से भी calf muscle pain होता है. Have you seen such patient? Hyperkalemia, जिसके अंदर patient having pain in cramps in calves. Lock standing, yes. One more cause I would like to add, that is vitamin E deficiency. Vitamin E deficiency is the most common. You can give patient to effusion or vitamin E medicine, effusion LC, patient having calf muscle pain as a supplementary. You can give magnesium as a supplementary, patient having calf muscle pain. Yes, Bhargav, hyperglycemia में भी pain होता है, very true. We have wonderful pain remedy especially for calf, that is LSP, that is arnica, that is cuprum mat, and one more my favorite remedy, that is gnaphalium. सर मैं रात को बेड पे जाता हूं और मुझे पैरों में दर्द होता है. मैं रात को जैसे ही पथारी में जाता हूं मुझे काफ मसल शुरू हो जाता है, that is gnaphalium. Read it from the book, guys. निकालो gnaphalium. Gnaphalium, LSP, cuprum mat, arnica. काफ मसल पेन की वजह से नींद नहीं आती है. पेशेंट व्हेन टेलिंग यू, सर मुझे पूरा दिन काम करता हूं, थक जाता हूं, पैरों में दर्द होता है, फिर भी नींद उड़ जाती है, थिंक ऑफ आर्निका. Are you with me? Open gnaphalium. Is it mentioned in book or not? Graphite is मेरी gnaphalium नहीं मिलेगा. Grandalia. Yes. Cramps in calf of legs and feet when in bed. जैसे ही पथारी में जाता हूं, जैसे ही बेड पे जाता हूं, I just got my calf muscle hurting. got my pain. Think of belly space, this specific medicine after overuse of muscles. Arnica is also there along with belly space. You can think for calf muscle pain. Calcaneus spur is also one of the leading condition in our practice, in GP practice. You can think of ruta. Ruta is more specific about Achilles tendonitis when the pain is at the over here. And in leg, I'm talking about leg. That is Achilles tendon is over here. And when patient is telling you I have pain over here, that is Achilles tendonitis. When we are talking about tendon, the remedy is ruta. When patient having pain over here, this is the heel. I'm showing you the leg portion. This is the heel. If patient having pain on heel, we can think of calcaneus spur. When you are examining the patient having pain over here, that might be a calcaneus spur pain. You can think of Rustox. Calcaneus spur having typical pain. Sir, मैं रात को सुबह उठता हूँ और एक्सेसिव पेन, मैं जमीन के ऊपर पैर नहीं रख सकता हूँ. The remedy is Rustox. Give Rustox in 10 ml. Heclalava is there for calcaneus spur. Aradia diadema is there for calcaneus spur. Calcarea floor is also there for calcaneus spur. Think of ruta, think of phyto. Phyto के अंदर, if I am not wrong, hanging gives amelioration. पैर लटकते रहे तो मुझे अच्छा लगता है, तो remedy is phyto. Please check it. Amelioration or aggravation? Phyto is elevating limb. Amelioration है या aggravation?
Elevating feet relieve the pain.
Yes, that is amelioration. तो पैर लटकते रहे, hanging रहे या elevated रहे, तो which gives amelioration. If I am not wrong, चिगर सर वो फाटक रेपर्टरी में single remedy है. Elevating legs gives amelioration. That is phytoleca. So when you get the symptom कि elevated पैर, मैं नीचे सो जाता हूँ या सोफे के ऊपर पैर elevated करता हूँ, which gives amelioration, think of phytoleca. Ruta is always there for calcaneus spur. Even Radium is always there for calcaneus spur. Radium having affinity on ankle. When you get the pain on ankle, always think of Radium. The first choice on ankle pain, that is Radium. Along with the typical modality of ankle, think of Radium with cold application with vapor amelioration. Colophyllum is also there. Another term, that is plantar fasciitis. When patient having pain in legs, in specific in plantar region, that is plantar fasciitis. It is quite confused with calcaneus spur. Again, we can go for X-ray. If X-ray is revealing that extra bone growth in heel, then that is the calcaneus spur. If it is not there, think of plantar fasciitis. There is no remedy in allopathic science or allied science for plantar fasciitis, guys. Simply they are prescribing NSAID, which gives relief temporarily. There is no permanent relief. Think of colophyllum, think of ruta in cases of plantar fasciitis. Even for small joint pain, you can think of ulmus. Ulmus is very rare remedy, but we are using this remedy frequently. Sometimes it is not available in pharmacy. They have to order it, but kept it in your place. If you are not responding with RT, you are not responding with causticum, you are not responding with colophyllum, you are not responding good with viola O, then think of ulmus. Yes, Neelam, I am coming to cervical pain. Cervical pain is always muscular pain. So when we are talking about muscular pain, when we are talking about great bellies of the muscle, the remedies are phytoleca, the remedies are semicifuga. When we are talking about tendon, the ruta is remedy. When we are talking about belly of muscle are more prominent in cervical region. Cervical muscles ke bellies are prominent compared to tendon. So when patient having pain or cervical region, always first choice is semicifuga. If patient having pain along with giddiness or along with vertigo or along with chakkar, you can think of cocculus eye. Cocculus eye have typical affinity on cervical region. Open cocculus eye. Is it there or not? Cocculus eye back, cracking of cervical vertebra when moving head. So we can think of this remedy in cervical spondylosis also. Paralytic pain in small of back, pain in shoulder and arm of bruise, pressure on scapular or nape, stiffness of moving shoulder. So cocculus eye have typical affinity on cervical region. You can think of cocculus eye along with semicifuga. Semicifuga we are frequently using and it helps the patient a lot. Use it 200 TDS. Cocculus eye, use it 200 TDS. Another remedy we have, that is acid phos, open phosphoric acid. Guys, in every case, in every condition, we are not going to find new remedy. Medicines in homeopathy remains are limited, but we have to work on that limited medicine with different aspects. Acid 4 we are using for diabetes mellitus, we are using for physical ability, we are using for mental ability. Along with that, when patient having severe pain on region of cervical region, we are using acid 4 for hair falling, early hair graying. Think of acid 4. है भाई कुछ बैक में? हाँ. Boring pain between the scapula. Between the scapula, when patient having pain on back, think of acid 4. Pain in back and limbs as if beaten. किसी ने मारा हो ऐसा लगता है, think of acid 4. Along with great stability. Acid 4, you can think, सर मैं जैसे ही घर पे जाता हूँ ऑफिस से, मुझे लेटना ही पड़ता है, मुझे सोया ही रहता हूँ. When wife is complaining you कि हस्बैंड घर पे आते ही सोते ही रहते हैं, न्यूज चैनल ही देखते रहते हैं. This sentence might have another thought, metaphoric thing. Sir, sexual desire is reduced of my husband. घर पे आके पड़े ही रहते हैं, कोई सोशल काम पसंद नहीं आता है, he has no interest in sex. Think of acid 4. If patient is diabetic, think of acid 4. Acid 4 is a sexual libido decrease due to diabetes. Are you with me? Are you following me, guys? These are the common remedies that helps a lot in our day-to-day practice. This is how we can manage pain. As pain is very vast subject, so it is quite difficult to explain in three hours. I have covered almost many medicines of pain. Each and every medicine have pain. When we are talking about pain, headache भी आ जाएगा, cardiac pain भी आ जाएगा, everything is there. If patient having pain on pectoral region, how will you differentiate cardiac pain from the muscular pain? Any specific thing you have to differentiate from cardiac from muscular pain? Sir, मुझे छाती में पेन हो रहा है, हार्ट का तो पेन नहीं है ना. How will you differentiate it? पेशेंट आएंगे आपके वहां पे, सर मुझे छाती में पेन हो रहा है, चेस्ट में पेन हो रहा है. How will you differentiate it? Yes, Bhargav. Perspiration and shortness of breath. पेशेंट आपके पास चेस्ट पेन लेके आया है, वो बहुत डरा हुआ है, वो he is thinking that is the cardiac pain, उसकी वजह से भी perspiration हो सकता है. Muscular pain, yes, Pujita, muscular pain increasing from taking deep breath, yes, it is one of the differentiating point. Cardiac pain aggravation on exertion, even muscular pain aggravate from exertion. Sometimes it is quite differentiate to differentiate cardiac pain from muscular pain. Yes, Nilaxi, cardiac pain is referred to other side. Even muscular pain can refer to the upper limb. Muscular pain is located in one side. Yes, even cardiac pain is located on one side, that is on left side. Along with palpitation, patient cardiac pain से नहीं लेकिन muscular pain से घबरा गया है, तो उसकी वजह से भी palpitation हो सकता है. Bhargav, nowadays don't rely on symptoms, must go for ECG. Bingo, we have to check ECG. Yes, Neelam, ECG is required. लेकिन clinically, when patient is telling you, sir, मुझे छाती में दर्द हो रहा है, ask the patient, आपको भारीपन हो रहा है या आपको दर्द हो रहा है? If patient is telling you, sir, मुझे भारीपन लग रहा है, मैडम मुझे भारीपन लग रहा है, that might be a cardiac pain, guys. Heaviness is chest is the leading symptom of cardiac pain. On exertion भारीपन लग रहा है, on exertion दर्द नहीं हो रहा है. More specific. I have one patient of cardiac pain. He is always complaining of heaviness. Patient is suffering from left ventricular hypertrophy. वो चरचराहट होता है क्या? He is suffering from the typical cardiac pain here. Some MD physician told him, if although you are suffering from cardiac pain, your pain might be muscular pain. हो सकता है ऐसा. लेकिन we have to rule out the cardiac thing. भार्गव, DCMP क्या है? What is DCMP? Dilated cardiomyopathy. Okay. So cardiac cause we have to rule out. From the भारीपन, heaviness is the key. घबराहट हो रही है. There is no medical terminology for घबराहट. If घबराहट is there, always think of cardiac pain. Always think. I'm not telling you every घबराहट is cardiac pain. When you are examined locally, when you feel the tenderness, there might be a muscular pain only. Tenderness is a key of muscular pain. As you all tell, कि radiating pain है, तो radiating pain can be muscular, can be cardiac. We have good remedies. that is digitalis. For pectoris pain, we have Bryonia for muscular pain. We have Spigelia with palpitation. Angina pain with palpitation. Think of Spigelia. Are you with me, guys? Spigelia. Bryonia for muscular. Spigelia is left-sided remedy, having palpitation. That palpitation even can hurt by another person. Spigelia is the remedy, having affinity on valvular affection, on valves of heart. When you get the patient of mitral valve problems, MVP, which is very common, और उसकी वजह से palpitation is there, think of Spigelia. These are the very common condition of pain. You can manage the pain in your practice. Any question, any query till now? Question for today's session?
सर ओस्टियोआर्थराइटिस आरे के ओए और आरे के पेशेंट आते हैं तो कई बार वो क्या बहुत लंबे टाइम से सफरिंग रहता है तो कुछ सिम्टम मोडालिटीज नहीं मिल पाती, सिर्फ एक ही पेन है और पेन में भी कुछ स्पेक्युलर नहीं.
Screen shows the above. Bhargav want to say something, but I'm not able to hear you guys. Any question, any query for pain management, any specific pain you want to learn, any specific medicine for any specific pain? Lightning, electric shock like pain, that is Sciatica and colophilo. When patient is telling you, sir, electric current pasar hota hai, aisa pain ho raha hai, think of Sciatica. Think of colophilo. Both having electric shock like pain. Another remedy, that is McFoss, having electric shock like pain. Current pasar hota hai. That is more common in neuralgic pain, especially in trigeminal neuralgia.
What are the symptoms of neuralgia?
So, lack of symptoms in case of OA and RA. If we don't have symptom, we can just work on a pathological thing. We can think of calcarea floor, we can think of osteoarthritis nosode, we can think of RA ke andar there is always pain. RA is always present with pain. If you are treating the RA patient is subside with your medication, don't change the medicine. Keep continue with the medicines. OA के अंदर swelling है तो go for Bryonia. OA के अंदर stiffness है तो give medicine for stiffness. Nosodes in RA, so RA or osteoarthritis, RA nosode is always present, always there. You can think of RA nosode. You can think of meadorhinum as a complementary. You can think of syphilinum as a complementary. Complementary medicines are very much required for chronic cases. क्या क्वेश्चन था?
Neuralgic, trigeminal neuralgia में pain वगैरह बढ़नी.
Trigeminal neuralgia is always confused with the toothache. When patient is telling you, ये आप diagnose कर रहे हैं trigeminal neuralgia, तो patient ऐसा बोलेगा, सर मुझे झटके आ रहे हैं. The specific word झटके, that is pricking pain. थोड़े थोड़े टाइम के बाद मुझे झटके आ रहे हैं. Burning is not present in every trigeminal neuralgia. लेकिन सडनली क्रैम्प्स आते हैं, सडनली प्रिकिंग पेन होता है, कीड़िया चटका पड़े ऐसा लगता है. In those cases, you can think of many remedies like Verbascum. you can think of McFoss, specific right side. That is mullein oil for left side sciatica. You can think of hypericum and think of lobelia. Question, Nilaxi, varicose veins. Varicose veins, you can think of carboveins, you can think of hypericum, hemamelis, you can think of calcarea flowor, you can think of vipera. Vipera is the specific remedy for varicose vein. Even acid floor is more about varicose ulcer. Even Cardus M is there for varicose ulcer. Yes, Dr. Bhargav, please explain different kind of pain. It is quite difficult. Each and every medicine have some different sensations. Drawing pain, pricking pain, stabbing pain. So lots of remedies are there that we will get from the repertory. 50 medicine hogi usme. But along with that typical medicine, when you get the modality, you can think of the typical medicine. Question from Sweta. Sweta, which medicine we think of numbness, in particular second and third toe, mainly while walking? Second and third toe, mainly while walking. Specific medicine तो पता नहीं है, लेकिन numbness के लिए you can think of chamomilla. Numbness, tingling, whatever it may be, you can think of chamomilla. One more thing I would like to add, that is radial nerve affection. Radial nerve की affinity कहाँ पे होती है? Thumb and first finger and half second finger, middle finger. That is the radial nerve. And this one is ulnar nerve. So when patient come to you with drop, that drop wrist, that is the radial nerve affection. In those cases, as a patient diet, you can think of plumbum metallicum. You can think of calmia, open calmia, guys. Okay, Nemisha hai your favorite remedy. Calmia. Where is calmia? Calmia is also having affinity on deltoid pain. कहाँ गया calmia? Mila, read it.
Pain along ulnar nerve, index fingers. Deltoid rheumatism, partially like
कहाँ लिखा है?
extremities.
Extremities. Pain along ulnar nerve. Ulnar nerve affection है. In those cases, you can think of this remedy. Index finger के ऊपर pain है. Patient is telling you, sir, मुझे यहाँ पे numbness होता है. Index finger, no, might be affection of ulnar nerve. Tingling and numbness along with that. One question from Bhumi, which medicine for RA with thyroid patient? उसकी कोई specific medicine मुझे नहीं पता है. Thyroid along with RA. No idea. Bhumi. आपको कुछ idea हो तो बताओ. Sir, cystic overgrowth just below the knee joint, which looks ganglion only. Approach should be same as ganglion. Yes, you can approach as a cyst. बेगर सिस्ट में तो पीछे होता है, पॉप्लिटियल फोसा में होता है. ये एंटीरियर साइड कौन सी सिस्ट होती है वो पता नहीं है, लेकिन यू कैन वॉक एज अ सिस्ट और यू कैन इवन थिंक ऑफ गैंग्लियन. वो रूटा और बेंजोइक एसिड भी दे सकते हैं. हाँ पारस भाई बोलो। Unmute myself. Okay, okay, okay. Am I audible? Yes. So we are concluding our session today. And those who enroll for the whole session, so next Sunday का जो session है, might be I am not able to take, वो हम next Sunday उसके बाद के Sunday को arrange करेंगे. I will confirm it to you by tomorrow. मैं आपको tomorrow message कर दूंगा in the group. So the next Sunday session might be arranged in next Sunday. उसके बाद के the next Sunday और arrange करेंगे. I will reveal the date. मैं आपको guide करूंगा, message करूंगा. Due to some reason, I will not able to join the session, especially at morning. So we are going to arrange it in next session, next Sunday. Any question? Any query, guys? Okay, see you in next session. Till then, enjoy prescribing, enjoy your reading, and keep connecting, keep in touch. Tag me on your Insta. तो स्टोरी भी डालते रहेंगे. It helps. Yes, Dhanushya, you are very active. See you in next session. Bye bye.